If you or a loved one has been experiencing memory loss, confusion, or changes in thinking, you may have heard the words dementia and Alzheimer's disease. These terms are often used interchangeably, but they don't mean the same thing. Understanding the difference is crucial. It can guide families toward the right care, improve communication with doctors, and help prepare for what's ahead. At Gentle Touch Home Assist, we believe knowledge is one of the most powerful tools families and caregivers can have. In this video, we'll break down what dementia and Alzheimer's are, how they differ, and how recognizing the distinction can help shape better care. What is dementia? Dementia is not a specific disease. It's a general term used to describe a decline in mental ability that interferes with daily life. Think of dementia as an umbrella under which many different conditions fall. The most common symptoms of dementia include short-term memory loss, difficulty solving problems or making decisions, confusion or disorientation, trouble with language or communication, changes in mood, behavior, or personality, and difficulty performing familiar tasks like cooking or managing medications. Dementia is caused by damage to brain cells that affects their ability to communicate. When brain cells can't talk to each other properly, thinking, behavior, and feelings can all be affected. Importantly, dementia is a syndrome, not a disease. A syndrome is a collection of symptoms that may be caused by one or more underlying conditions. What causes dementia? There are, many causes of dementia, including Alzheimer's disease, which is actually the most common cause, making up around 60 to 80% of cases. There's also vascular dementia, which is often caused by stroke or reduced blood flow to the brain. Then there's Lewy body dementia, which involves abnormal protein deposits in the brain. Another type is frontotemporal dementia, which affects the frontal and temporal lobes, and often causes early personality and behavior changes. And of course, there's mixed dementia, a combination of two or more types. Other conditions, like Parkinson's disease, Huntington's disease, chronic alcohol use, and even infections or vitamin deficiencies, can also cause symptoms of dementia. Some causes of dementia are actually reversible if caught early, such as medication side effects, depression, or thyroid issues, which makes early diagnosis extremely important. So, what is Alzheimer's disease? Well, it's a specific, progressive brain disorder and actually the leading cause of dementia. It slowly destroys memory and cognitive abilities over time. Now, the exact cause of Alzheimer's isn't fully understood, but it's believed to involve the buildup of abnormal proteins, like amyloid plaques and tau tangles, in the brain. These proteins disrupt communication between nerve cells and, eventually, lead to brain cell death. Typical symptoms of Alzheimer's disease include trouble remembering newly learned information, repeating questions or misplacing items, and difficulty recognizing familiar faces or places. There can also be confusion with time or place problems with speaking or writing and withdrawal from work or social activities. You might also notice changes in mood and personality. As the disease progresses, individuals lose the ability to carry out basic tasks like eating, dressing, and communicating. Let's talk about the key differences between dementia and Alzheimer's. Dementia is a general term for a group of symptoms, while Alzheimer's disease is a specific disease that causes dementia. Dementia can have many causes, and in some cases may even be reversible, depending on the cause. On the other hand, Alzheimer's is the most common cause of dementia and is progressive and irreversible. Dementia can affect memory, language, judgment, mood, and behavior, whereas Alzheimer's primarily affects memory and cognitive function, but eventually impacts all aspects of functioning. Symptoms of dementia can vary based on the type, but Alzheimer's tends to follow a relatively predictable pattern of decline. So, why does this distinction really matter? Well, for families and caregivers, understanding the difference between dementia and Alzheimer's helps in several important ways. You know, an accurate diagnosis leads to better care planning and treatment options. When you know what to expect, it allows families to prepare both emotionally and financially. Proper support can be provided, like specialized memory care services. Early interventions may, in some cases, slow progression or improve quality of life. And honestly, it also reduces confusion when speaking with healthcare providers or when you're seeking outside help. At Gentle Touch Home Assist, we offer in-home care that's really designed to support individuals living with Alzheimer's disease and other forms of dementia. Our caregivers are trained to provide compassionate, respectful care that adapts as needs change over time. We help with memory care support that's tailored to the stage of decline, medication reminders, and wellness checks. We also assist with personal hygiene, dressing, and mobility. Safe and familiar routines help reduce anxiety, while companionship can ease feelings of loneliness and confusion. Fall prevention and home safety monitoring are also part of our services. We work closely with families to create care plans that respect each client's preferences, dignity, and changing needs. Final thoughts. Hearing that a loved one may have dementia or Alzheimer's can feel overwhelming, and honestly, it's a tough journey. But you're not alone. With early support, education, and compassionate care, it's possible to maintain quality of life, build meaningful moments, and reduce stress for both the individual and their family. If you're navigating memory loss in your family, Gentle Touch Home Assist is here to help, with the heart, training, and experience you can trust. Please, contact us today to learn more or to schedule a free consultation.